Welcome to the Virtual Respiratory Care Lab at BGSU Firelands. In today's lesson, we will be looking at various oxygen devices. You will learn how to select the appropriate device and how to use the different devices available. We will start by answering the question, why do we use oxygen? Our body needs oxygen to stay alive, but how much oxygen do we need? Well, our body is happy with 80 to 100 millimeters of mercury of oxygen in the blood. We can check this level by drawing an arterial blood gas to measure the amount of oxygen in the blood. This is very accurate, but can be painful due to the needle used to draw the blood. Is there another option? Another way we can check to see if our patient is getting enough oxygen is to use a pulse oximeter. This device non-invasively measures the amount of hemoglobin in the blood that is bound to oxygen. You simply place the oximetry probe on the patient's finger and read the saturation from the screen. Our body is happy with an oxygen saturation between 92 and 100%. So what do we do when our patient's oxygen level is too low? We need to look at administering an oxygen device to raise their levels of oxygen back to normal. Oxygen devices provide additional oxygen for our patients to breathe in order to raise the oxygen level in the lungs. The oxygen travels from the lungs into the bloodstream and then around the body to the tissues where it is needed. The most common device is a nasal cannula. This device has nasal prongs that are placed in the patient's nares to provide supplemental oxygen to the room air that they breathe. You place the prongs into the nares, angling back, following the natural curvature into the nasal passages. The tubing then goes behind the ears and back around to the front of the patient to cinch up under their chin. This will hold the nasal cannula in place. You will need to connect the other end of the nasal cannula to an oxygen flow meter and set a flow rate. For a nasal cannula, this will be between 1 and 6 liters per minute. This will give the patient approximately 24 to 44% of supplemental oxygen. So for patients who only need a smaller amount of supplemental oxygen, this would be a great device. What do we do if our patient needs a very large amount of oxygen? In this case, we would choose to use a non-rebreather mask. This device has a mask that goes over the patient's mouth and nose. When placing the mask on the patient's face, be sure to use the strap to hold it in place. It will go behind the patient's head and up over their ears. You will connect the other end of the tubing to an oxygen flow meter and set the rate at about 12 liters per minute. You also need to be sure that the bag hooked to the mask is inflated. It should not fully collapse at any time while the patient is breathing, although you can expect it to deflate partially when the patient takes a breath. If it does collapse, increase the liter flow on the device. Patients do not breathe any room air when using this device. We are providing everything that they need. This device provides approximately 100% oxygen to the patient. In closing, practice with these devices during your lab time to become more comfortable with them. Also, complete the exercises in your lab manual to learn more about these devices and how they work. If you have any questions, please contact me so that I can help. Thank you for joining me today in the Virtual Respiratory Care Lab.